Okay, I think it says recording on my screen. Do you see that?
Yep.
Okay, so in this interview today, we have Kelly Fritz, who lives in Portland. She graduated from the University of New England with a doctorate in physical therapy in 2018. She has worked in a variety of pediatric settings in Maine, including schools, a pediatric outpatient clinic, and preschools. Her current role is with the state of Maine and Child Development Services, working with children 0 to 3 years old. She is passionate about working with children with disabilities, serving underserved communities, advocating for the rights of people with disabilities, and improving prevention, screening, and outreach in the state to improve children's health outcomes. And I'm super excited to have her here because this is an area that I have never really heard much about, especially even as a new mom. I have a 17-month-old child, and a lot of the stuff she's going to talk about before or later in this interview, I have never heard about before. So this is a great example of outreach with community health. So it's really important to emphasize here too that both clinical and public health workforces, so non-clinical, are vital to achieving the goals of the Patient Protection and Affordable Care Act, which aim to improve access to and quality of healthcare and to reduce costs, which is some of the primary aims of public health. Achieving these goals prevents significant challenges owing to the overall burden of chronic disease, social determinants of health, an aging population, a lack of population health literacy, and many other factors. In our country, the majority of healthcare spending and deaths in the United States are related to expensive, debilitating chronic diseases, such as obesity, diabetes, high blood pressure, things that we've just covered actually in the previous lectures, as well as disabilities, which Kelly's going to start to kind of bridge that gap for me here. And a lot of these factors, as we've learned so far in this course, can be reduced or modified through behavioral and or therapeutic interventions. So that's enough from me. I'm going to let Kelly kind of take it away here, and we'll kind of have some questions as we go along. So thanks for joining us, Kelly. And
of course, I'm happy to be here. So like Tara said, I am a pediatric physical therapist, and a lot of folks don't really understand what that means or what I do. And so pediatric PT, in general, physical therapy aims to improve movement and function for people both with and without disabilities. So most people that hear I'm a PT think that maybe a baby has torn their ACL and I'm going to help them rehab, but that's actually not the case. Most of the children that I see, I work with them because they have what's called a delayed milestone. And I'll go in more depth of what a milestone means, but essentially, an infant is born and they have this progressive skill that they learn over time. So if you've ever been around a baby or a young child, you know that they start lifting their head, they do tummy time, they learn to sit, they learn to walk. And even after walking, there's more milestones that come. So children learn to ride a tricycle or climb the stairs. And there's a variety of reasons that children might not meet those milestones. So the purpose of pediatric PT is in a very play-based and functional way. I work on strengthening those children's muscles, working with parents to improve the relationship that they have with kids, and overall improving their participation in the day. So you and I might participate in our day by going to work, doing hobbies, things like that. But what children do all day, every day is they play. And that is how they learn. So kids play inside and outside. They play with their parents, their siblings, or their peers. And if a child is not able to move, it is really hard for them to do those activities. And so I like to say that I'm a master in tricking children. So literally all I do at work when it's not COVID is play with kids. And I might move their toy further away from them or move their toy higher up in the sky. And
I'm noting some of these.
With all of those things, their bodies are moving towards that kind of goal of sitting up or laying down or standing up at the couch because they can't reach their toy. And so those are just kind of some of the things that I do with kids every day that I would call an intervention. And those over and over and over throughout their day, to them, they think they're playing, but to me, they're doing repetitions of squats or repetitions of climbing the stairs and things like that. So that's how I trick kids all day. And I work with children that are 0 to 3, so I also often work with their families. So I might talk to a parent about how to do tummy time better, or why a child might not be able to do tummy time. And there can be medical reasons. There can be reasons because the parent picks them up every time they squawk when they do tummy time. There's a million different reasons that some of these milestones aren't met. Another thing to think of is some of the children I work with have disabilities where there's no expectation that they might ever walk. And so mobility isn't always walking independently. Sometimes mobility is having access to a wheelchair or other adaptive equipment, having access to a walker, and I will fit those kinds of pieces of equipment or teach families and children how to use them. So if you've ever seen someone walking with braces or using a power wheelchair, that's their form of mobility. And that starts at a really young age. So if a child is 18 months old and they should be moving and they're not yet, I might look at different options for how to get them moving independently, even if it's from a piece of equipment. So some of the children that I see are children that are at risk for disability or delays. And that would look like a child who was born prematurely. So not all children who are born premature have a delay in milestones, but many of them do, and they're at risk. I see children with a birth injury. So sometimes, they can have a nerve or a shoulder dislocation or a hip dislocation because of the way that they were born, and I might see them. I also see children who have disabilities that you might be familiar with. So things like cerebral palsy or Down syndrome and other genetic disorders. So all of these children still have the potential to participate in everything that you and I participate in. They just need more support often, and they might have weaker muscles or they might need to learn to move differently. So I work with those children to do that. I think you'll also find it interesting that there are environmental factors that can impact child's development. So we think about poor healthcare, lack of follow-up services, the family unit and their access to food, things like abuse and neglect. Those can all impact child's development. So even if the child was born totally normal and typical and there were no birth injuries or anything, if a child doesn't have access to a caregiver and they don't have access to a safe environment, they can have delayed milestones. So in general, milestones, we talk a lot in the United States about walking. That's kind of the biggest one that everyone celebrates. And then when you talk about other settings of milestones, we think about a kid's first word. But I like to talk about the importance of other milestones. So things that I've mentioned before, like tummy time and sitting and crawling, all of those lead to the strengthening of muscles that eventually result in walking. And then I have those complex milestones that come after walking. So after a child's learned to walk, they still learn to climb the stairs, to ride a bike, to play in gym class. And so when you look at kids across the lifespan, those are some of the things that for a child that's already walking might still need physical therapy as a child. And some of the—
So I have one question for you. So this is more of a personal question since I'm just sort of right now experiencing some of this. How do you know as a parent or even as a community health education specialist, you're kind of working in the community and you're a witness to some of these things, how do you differentiate between a normal delay and an abnormal delay? Because I know there's also kind of like a philosophy out there, like, don't get too fixated on milestones because every child develops at a different rate. And that's something personally that I've done because I was like, I will drive myself crazy worrying about this if he's not like on this day walking. How do you differentiate between what's normal and abnormal?
Yeah, so I think there's a couple answers to that question. So first, there's a really great resource that's put out by the CDC, and it's called the Learn the Signs, Act Early. And I'll share that link with you. But the website has different fact sheets for different ages. And one thing that I really like about their fact sheets is that it doesn't say 12 months. It has an age span. So most milestones, depending on cultural differences, family differences, parenting differences. There's actually like a pretty wide range. So normal walking is anywhere from 9 months to 18 months. So some children learn to walk super early, and some children don't learn to walk until 18 months, and that's all considered normal. And the CDC website has some really great fact sheets, and they come in a lot of different languages, and they just tell you in non-medical terms, like, you know, should your baby be babbling? Should your baby have 3 to 5 words or 50 words? And should your child be pulling to stand and things like that, which is really great. They also
That's
have
perfect to know. Oh, sorry. Like I said, well, Kelly is going to share that link with us, so we'll look at some of those fact sheets. But in this course, we have been looking at different CDC fact sheets and just learning how to find information. So this is another great resource that we can kind of plug right in. So
yeah, it's awesome. And also families really like, they have an app that you can download onto your phone, and you actually put your kid's birthday in, and you can say like what's happening at the different, however old they are, and it'll tell you like, you're good to go, you're green, or you're yellow, maybe you should bring it up with your pediatrician, or things like that. So that's a really great resource as well. And it's on that link. Another thing that I like to tell people is, and this is kind of one of those health things that drives me bonkers. A lot of families will come, I have multiple kids on my caseload right now that are between 10 and 16 to 18 months. And the thing that the parents say is like, well, I told the pediatrician I was concerned, and they said, well, just wait and see, just wait and see. But if you're a parent and your gut tells you that something is not right, it is your right to follow up on it. And that's the great thing about early intervention. And in Maine, it's called Child Development Services. And a parent can call and request a screening for their child. They can say, I'm concerned, I went to the pediatrician, or I didn't go to the pediatrician. It doesn't matter. And you can call and say, I would like a developmental screening. And if, you know, the screening is concerning to the early intervention staff, then they would do a full developmental evaluation.
So even if you don't necessarily agree with what your doctor's saying, you can still get additional services. That's awesome.
And that is another piece of information that's on the CDC. They have the direct phone number of every early intervention service in the United States. So in Maine, it's called Child Development Services, and in other states, it has other names. But in general, you are allowed to call and make that referral, which is really great.
And that's so good to know.
Yeah. So that falls in really nicely to the next thing I wanted to talk about, which is, what do families do if they're concerned? And so first would be to bring it up with your pediatrician, or talk to your friends, or talk to your, community health worker, and see, what should I do? Is this normal? Is this not? And reach out for those resources. And then again, they can call the early intervention services directly in their state and ask for a referral. And it's unfortunate that it's just not a well-known piece of information. So I think that that's really powerful, especially for families that are, in Maine, we have a large immigrant community, and unfortunately, those folks often have lesser access to care or poor quality care. And so sometimes marginalized communities are not as respected when they're at the doctor. And so they might say, this isn't normal, I'm worried, or there might be a communication barrier. For whatever reason, the referral doesn't happen. So being able to empower the families with that information is really important.
Absolutely. And I would say, so I'm also developing right now a cultural competency course. And so we'll be doing some cultural competency audits throughout the state. So if you have any resources on that, definitely send them my way too. But another thing, and another reason why we're doing some of these interviews with professionals in the community, is so that we can all be aware, because as community health specialists, a big part of our job and even livelihood, and you don't have to necessarily separate your personal life from professional life, is being an advocate. Mm-hmm. You can share knowledge with anybody. And just knowing, now that I know this information, even if I'm not on the clock, like, I will definitely share this information with other mothers or families that I'm aware of. And so part of it is just being aware, gaining awareness, and not being afraid to speak up if you feel like information is warranted.
Absolutely. I think on a personal note, I don't have children, but my Facebook definitely thinks I do, because like all of the groups I follow, like I even follow some mom groups, because I think it's important for me to know like what's being talked about, like what's the trend, and to be able to be
Mhm.
informed. And then I share a lot of resources, like things from the CDC and things like that, and hope that it gets spread elsewhere. So yeah, I think you can always be sharing information and advocating for your community, which is really important. So talking about
Definitely.
kind of marginalized communities or lower income groups, the other really great thing about early intervention services that are through the state is that it's a federally supported and publicly funded. So every state has either very low cost or free cost of services. So if a family doesn't have insurance, they are still able to receive services. We do bill Maine Care for a lot of our services, but if there's circumstances where a family's been denied Maine Care and they don't have private insurance, or new immigrants that have come over and don't have insurance yet, they can still receive services, and that's across the United States because it's a federal program. Um, yeah, so the next thing that I think is important is just to talk about why early intervention is important. So I specifically work with children that are 0 to 3 years old, but I have worked previously in preschools as well as school settings. And when we talk about the burden of our healthcare costs, catching these things early is super important. So, if a child is not performing tummy time or they're walking late and we wait until they're 3 or 5 years old to intervene, there's going to be a lot of other things that are catching up. So when we talk about what comes after walking, there's so many skills that are learned between like 3 and 5 years old. And so every single skill is getting more and more delayed. And unfortunately, in the state of Maine, with a pretty rural population, it's not uncommon to have children come to preschool or even come to kindergarten and not be able to play on playground equipment or not be able to climb the stairs. And that's something that a child should be learning to do at about 2 years old. They're starting to walk up the stairs for sure. So you think of the impact of that should be happening at 2, and now they're in kindergarten and they can't do that, and thinking of how that impacts everything in their life, their access to physical activity. They probably can't participate in gym class, so they're at risk for obesity. They might be made fun of by their peers because they're moving slow, and there's just so many other things that happen. And another thing is neuroplasticity, which means that the brain is very moldable when you're young. So that's why we have these bursts of language and movement and development that happen, because your brain as a young infant is just soaking up all this knowledge. So it's a really, really important time frame to be able to intervene for children in motor areas, speech areas, behavior management, all kinds of things like that. And so it really
Yeah,
improves.
that ripple effect, that's a great, great point. It does have ripples into a lot of different areas that we typically think of as public health interventions, with chronic disease and overweightness and obesity and all of it.
Yeah, and social emotional development, thinking of just, we talk again, a child's, their occupation is to play, but if they can't play on the playground or they can't play tag because they don't know how to run, that's so many impacts in so many ways. So I think I really, really push for, I think the coolest thing about PT is that there is a very big piece that's prevention, especially for 0 to 3. If a child qualifies, and even if they learn to walk and then they're doing really well, we can continue following them until they turn 3, just to make sure that everything's going well. And when a child gets to school, it's a little bit different how a child qualifies. So it's still federally funded, and it's still a public thing through the state, but there's a lot more criteria in order to receive those services. So when you're receiving services as an older child, it has to impact your education and your school day. And there's a lot of times that I have to very strongly advocate at the table for a child why playing on the playground is impacting their education and their school day. And not everyone agrees that it is impacting. and it's harder
Yeah, I
to
can see that
qualify.
being a hard argument.
Yeah, yeah, it's not fun. When I say they can't play in gym class, they're like, that's fine. Like, they don't need to play in gym class. So it's a lot easier to qualify for, it's a little bit easier to qualify for services in early intervention. And then it's a lot more kind of bang for your buck. There's a lot more progress that's seen, and which is so fun as a therapist. You know, I get kids that I see progress every week. I saw a child today that had 3 new skills, and I saw him last week. So in that short time frame, things are just, you know, exploding, which is really cool.
That's awesome.
Yeah. So yeah, the only other thing that I really have that I kind of already touched on is if a child is older and you feel like maybe they've missed early intervention and how that works. So when a child is older than 3, generally it's attached to the public schools at that time. And so you would call your local public school if you wanted a developmental evaluation. Maine is a little bit different, where our preschools are not tied to our public schools. A lot of them are private, but that's kind of being talked about changing. So over the years, that'll be something just to kind of keep track of. And if your preschools are attached to a public school, then you would call the local public school and request an evaluation. And then,
as a parent, you would do that.
Yep. Yeah, as a parent,
Okay.
you can still do that.
Okay.
Yeah, you don't need a doctor's referral because, well, PT is technically direct access in the state of Maine, as long as the person's not being seen for more than 120 days, and then you need a doctor's script. But just for the referral piece, because we are tied to special education and the Maine Department of Education, it's less of that kind of medical referral like you would need for a neurologist or something like that. So it can be self-referral, it could be grandparents, you know, like if you have a family where you're not sure that the parents are, you know, really able to independently make those decisions and take care of, you can educate the other caregivers or family members that they're able to call and make a referral as well.
Awesome. That's great to know. It's just from the community health side too. It, you know, who do you go to? Who do you reach out to for help? You know.
Mm-hmm. Well, and there's a lot of, I mean, I would say I would definitely go to the pediatrician just because, you know, that's a good kind of home base, so that they have all the information going through them. But I would definitely encourage, you know, if you're running into a situation where that's not getting you what you need, or the parent is still concerned and being, my pet peeve is wait and see, they'll figure it out. And I really don't.
And that was one of my questions to you, you know, as a parent and just being, you know, a human interacting with society. That's something that you do hear a lot. It's like, oh, they might grow out of it, or this person got injured, you know, coming from the sports industry. Oh, it'll heal over time. It's like, no.
Or it
if you feel
could,
concerned,
you know,
I think you should reach out.
if you have an ankle sprain and you never, you know, go to the doctor or get PT, you will probably be better eventually, but you might not be as good as you were before, or you might not reach your potential. And I think especially when multiple milestones are kind of adding up. So tummy time was hard, and sitting was hard, and crawling was late, and walking was late. Like, you know, it's like one thing after another is where it kind of starts getting concerning, within those large.
Yeah, and I think that, yeah, I think we'll take a look at those fact sheets as a class, but I think that could be confusing for a parent because some children don't crawl, they just go right to walking. So it's like, is that okay? I know it's, you know, recommended that they're supposed to crawl and then walk.
Yeah, so crawling is actually a really important milestone, and that's where I think it's kind of a cultural thing. The US is like, walk, 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 run. They're going to go to the Olympics because they never crawled, and that's really not true. If you think of an infant and all of the hand muscles and shoulder muscles that are developed in crawling, as well as, so the way that our brain works is one side of the brain talks to the opposite side of the body. And so when you're crawling, all of those brain waves are crossing because you're alternating what's moving.
That's interesting.
And there's actually some really cool research that it leads to like better reading ability, and it's a really important milestone. So
So
They're
don't
all important.
push kids to not crawl.
Yes, no, kids should not learn to walk before they do other things. Yeah.
Now my son, he is like kind of running at this point, but he kind of crawls. It's almost like he's mocking us, which is pretty funny. He's just getting really
Well,
smart.
I've seen him before and his motor skills are beautiful. So
Yeah,
I can't help but keep an eye on every child that I see.
right. I think personally we've been fortunate because he is a healthy child, so we don't have that direct experience of experiencing this. So,
Mhm.
but I think the more we know, the more we can spread the word and become aware and just help each
Yeah.
other out.
And I
So,
think education is so important. I think sometimes people hesitate because they don't want to be the bearer of bad news, but
yes,
it's
especially
especially
with
in
parenting, I think.
yeah, but especially in early intervention, it's not necessarily bad news because if you catch it really early, it's like do this instead of that, and when you're playing, try this, and then you see progress. So,
Right.
it's not. I think it's important that, and I'm very passionate about working with people with disabilities, and so in my mind, like a child with Down syndrome is the same as a typical child. They just need a little extra help with some skills. But I do think that some people think if their child has a delayed milestone, like, oh my gosh, does that mean that they have a disability? And that's not true. And also it's not the end of the world because people with disabilities still live very fulfilling, meaningful lives. They just sometimes need extra help doing it. So
Yep. And that is a great way to kind of segue. I think that's one of the primary aims of public health is to, not only prevent disease and disability, but we want to increase the quality of life. And so that's exactly what something like this can do if we, focus on that early intervention. So I'm scanning my list of questions real quick, but I think you actually answered everything in this amazing interview. So unless you have anything else,
no, I think on my notes I got everything as well. So
awesome. Well, thank you so, so much. And I will end this and we will post this on our learning management site and our future Facebook page, as well as the resources that Kelly has shared with us from the CDC and fact sheets. We'll plug this into several different topic areas. We have women, infants, and children coming up. We have a disability section. We have cultural competency. So Kelly kind of touched on all of these areas that we can kind of pepper this in. So this is a great topic to gain awareness in. So thank you so, so much, Kelly. And
of course, happy
if
to be
anything
here.
comes up, I may have some students reach out to you and vice versa. If you need anything from us, just let us know.
Yeah, anytime.
Awesome. Thanks so much.